Hi, this is Jennifer, and this is my submission for the teaching video. I am using my teaching plan on preventing complications of gestational diabetes, and the objective that I will be teaching to is that the patient will, following a 30-minute teaching lesson, the patient or learner will be able to verbalize 3 benefits of exercise in those diagnosed with gestational diabetes. And that they will verbalize these with 100% accuracy. So now I'm gonna go into some role playing. Hi, my name is Jen, and I am the nurse educator for your OBGYN practice. And the reason for your appointment today is that we'd like to take some time to review to further review with you your gestational diabetes and provide some follow-up and build on from our lesson last week. At last week's appointment, we discussed the generalities of gestational diabetes, including managing your diet and how to check your blood sugar levels. How do you feel that you did this week? So the patient responds and says that she feels that she did really great. She wasn't concerned with utilizing the machinery and that she felt very comfortable. So that's great. So today we're going to build a little bit more, as this is a very it's a problematic condition to have in pregnancy, so we really want to make sure that we provide you with all the education we can to manage it in the best way that you can and make you feel comfortable at home, because that's where you mostly are, is at home. We aren't able to, watch you all the time, so we want to empower you with the information so that you feel comfortable taking care of yourself. So this week, we are going to discuss the benefits that exercise has for women who have been diagnosed with gestational diabetes. First, exercise kind of gets a bad rap. I mean, people think that, we'll talk about dieting and that they didn't have to exercise to lose weight, but the truth of the matter is, exercise may not always be fun, but it is something that has benefits for everyone, whether you are a gestational diabetic, whether you're pregnant, or whether you're just a normal person. And actually, the American Heart Association recommends 30 minutes a day for everyone to improve heart health. So, when we're talking about exercise, I don't want it to be this scary topic. It's something that really is recommended for everyone, and even if you haven't exercised before, it's nothing to be scared of, and certainly it's not a scary thing for your pregnancy. But also, in pregnancy and when you are diagnosed with gestational diabetes, it can be very important because exercise actually helps to keep your blood sugar levels under better control than patients who don't exercise. So last week we discussed that you feel that you learn best through a combination of audio and visual materials. So this week I have a video for us to review together. It's published online by the Joslin Institute for Diabetes. They're like a nationwide specialist in diabetes, and this video specifically talks about the safety and importance of exercising in pregnancy when diagnosed with gestational diabetes. So we're gonna go ahead and watch this video. It's only about 5 minutes. So the video plays, and then we're gonna transition on to discussion of the video and asking the patient what she learned from the video and elaborate on some of the points. So after this video, but before we get started with kind of the commentary, I just want to discuss with you the fact that a lot of women are really scared when they hear the word exercise, as they may be worried about harming the baby. There's a lot of people out there who give misinformation saying exercise isn't safe. How do you feel about exercise during the pregnancy? Do you feel that it's safe, or do you have any major concerns? So the patient responds with, she didn't really exercise before the pregnancy, but that she's worried that exercising may harm the baby, that she may fall, or there may be some complication with exercising. So the point of this exercise is to, make the patient feel comfortable, and use open-ended question. So we're going to go ahead and watch the video, and then we're going to see if we can't get you to feel more comfortable with exercising during pregnancy. So what did you think of that video? Are there any important things that you noticed or stood out to you? The patient states that she noticed the woman who was leading the video was also pregnant, and that made her feel more comfortable with the instruction and the incorporation of exercise in pregnancy. The patient also stated that she had no idea that all of these forms of exercise could be safe during pregnancy and previously did not understand how exercise impacted blood sugar levels. So now that we've identified that exercise is safe in pregnancy and you feel comfortable with the idea, let's talk about the benefits for exercise for women with gestational diabetes. So let's take a look at your blood sugar logs. I know that you brought them today, and we gave you the task to write everything down this week. So I see that your fasting blood sugar levels seem to be consistently elevated in the morning. One of the benefits of exercise, especially at night after dinner, is that it has been studied to reduce fasting blood sugar ratings specifically. And this may prevent the need for you to require oral medications or even insulin to manage your blood sugar levels. Because as we discussed at the last visit, you take your blood sugars 4 times a day. And even if only one of your blood sugar levels, such as your fasting, is consistently elevated throughout the week, that would kind of signal us that your body needs some help with managing your glucose levels, and we would move to oral medications first. So if we can do something to maybe help some of these fasting levels, that'll help reduce your risk for this possible intervention. So just to discuss, after you eat and the reason why exercise is beneficial, after you eat, your body breaks down the food ultimately into glucose, which is required for your cells to make energy. They further turn that into additional molecules. However, by exercising after a meal, you give the body purpose for that glucose. If you have too much glucose floating around in your blood system, your body produces insulin, which serves as like a key to bring it into the cells. If you have too much glucose in your system, your body is constantly manufacturing insulin, and it can get tired, and your cells develop a sensitivity. So by exercising, especially after you eat, it gives your body the opportunity to utilize that glucose first. Does that make sense to you? The patient replies, yes. What was another benefit that you noticed from the video? The patient said that she noticed that there's a decreased risk of type 2 diabetes after pregnancy. Yes, exercising in conjunction with a modified diet can help you decrease your risk for developing type 2 diabetes, which by having gestational diabetes, you are at a higher risk for developing. After you deliver, we'll recommend that you continue to check your glucose readings randomly, and we'll obtain a 2-hour fasting glucose check at your 6-week postpartum visit. So we've discussed the 3 key benefits that exercise plays in patients with gestational diabetes that you have identified after watching this video. Do you feel like you could integrate a simple exercise such as walking after dinner? Yes, says the patient. Perfect. Well, I have an additional blood sugar log that also includes a space for exercise. I want you to make sure that you write down the time that you exercise, and we will check back in next week and see how those fasting glucose levels respond. Also, I have an additional handout for you to review at home. It's called Walk to Success. I know that the video reviewed numerous different types of exercise, such as weight training and other forms of cardio and going to a gym, but because you've never exercised before, I feel like it's important to start with something super simple, such as walking. So this little pamphlet will kind of review all of the safety things that you would need to know about walking and walking in pregnancy. These would be reasons that you would want to stop, and problems that would arise that we would want you to call the office. Remember, our office is available anytime. Even after hours, you can reach us through our answering service. And if it's an emergency, you'll be connected with the on-call physician. And at any time, if you feel like there's something wrong, you can always go to the